Sejal has come to visit her friend Pooja.
What are all these tablets and syrups for? These tablets and syrups are for my asthma. Pooja, inhalers are better than oral medications. You should visit a doctor to get a better idea.
Pooja visits the doctor for consultation.
Doctor, I need some advice. I have asthma and I've been using tablets and syrups to manage it. But I was told that inhalers work better for managing asthma. Is that true?
Yes, Pooja, that is absolutely correct. Let me show you the key reason why inhalers are better. Oral medication takes a longer time to act because it is first absorbed by the digestive system and then delivered to the lungs. Inhaler medication goes directly to the lungs where it is needed and acts immediately, providing instant relief from asthma symptoms. Inhaler medication is delivered directly to the lung, therefore smaller dose is required and it gives fast relief. Oral medication requires a larger dose and may result in side effects, while inhaler medication requires a smaller dose, therefore has minimal side effects.
Oh, I understand now. Inhaler medication is a better choice. Thank you, doctor, for the right advice.
Choose inhalers for asthma management and you can always breathe free. The doctor is prescribing inhaler as a treatment. Mrs. Verma is concerned about her son being prescribed inhaler as a treatment.
Doctor, are inhalers habit forming?
Using inhalers will not cause addiction. It's like a good habit. Just like brushing your teeth and exercising, using inhalers daily is a good habit, not an addiction. Inhalers are to be used as prescribed, and he will be able to live a healthy life.
Doctor, does regular use of inhalers stunt child's growth?
Mrs. Verma, inhalers have next to no side effects. I can assure you, he'll grow to normal adult height.
Doctor, won't tablets and syrups be a better option?
During an eye infection, we put eye drops directly into the eyes. And for skin infection, apply ointments directly on the skin. Similarly, for problems related to the lungs, the medication should be delivered directly to the lungs via an inhaler.
What about the strong medication used in inhalers? It must be harmful.
Not at all. The medication is delivered in small doses directly to the lungs. Such small doses do not cause any harm, but are quite effective for asthma treatment. Mrs. Verma is now more confident about using inhaler for her son. Inhalers are the best treatment to manage asthma. So choose inhalers and you can always breathe free.
Hello, my name is Shruti. I have asthma. But that doesn't stop me from doing things I want to do. All I need is to be careful. Asthma symptoms usually develop when there is a trigger. These triggers vary from person to person. These triggers could be cold, air or smoke, heavy exercising, even playing with pets or certain foods like seafood, milk and peanuts. If you are aware of your triggers and avoid them, you can stay protected. So, do remember to watch out for common triggers such as dust mites, cigarette smoke, pollen from flowers, pet, indoor air pollutants, weather change, physical strain on your body like heavy exercising, sprays, and even strong emotions such as anger. Avoid these triggers to manage asthma. If I just take the right precautions around these things, I know I can control my asthma.
Hey there, my name is Aisha. Ever since I was a little girl, I had problems breathing on certain occasions. My parents were worried. It took some time for us to realize that I suffered from asthma. In the meantime, I learnt about controlling it and could lead a normal life. I recognized my symptoms early in life and I was cautious since childhood. So, watch out for the common symptoms of asthma, like breathlessness or difficulty in breathing, wheezing or whistling sound while you breathe, a feeling of sudden tightness in your chest, or awakening with a start at night due to cough and breathlessness, frequent coughing without fever that doesn't go away for days. If you experience such symptoms, then you should consult your doctor immediately. Control the symptoms: breathlessness, wheezing, tightness in your chest, frequent nighttime awakening, frequent coughing. Remember, asthma can be controlled. If diagnosed early and managed properly, you can breathe free.
In this video, we will show you how to use a pressurized meter dose inhaler or PMDI with a dose counter. This is a PMDI pack. It contains a pressurized meter dose inhaler with the dose counter and a patient information leaflet. You should always refer the patient information leaflet before using the inhaler. Different parts of a PMDI: mouthpiece cap, mouthpiece, canister, actuator, dose counter. The dose counter counts the number of doses in the inhaler. Let us see how to read the dose counter. Dose counter shows the number
120,
indicating the number of puffs in the inhaler. As you use the inhaler, the dose counter will count down at an interval of 20. When there are 40 puffs remaining, the color on the dose counter will change from green to red. This indicates fewer doses are remaining in the inhaler and the patient should consider getting a new inhaler. When the dose counter displays 0, it means there is no more medicine left in the inhaler and the inhaler should be discarded. The inhaler may not feel empty and may continue to operate, but it will not deliver the right amount of medicine if used beyond 0. If you are using the inhaler for the first time or have not used your inhaler for more than a week, remove the cap from the mouthpiece and make sure that the mouthpiece is clean. Hold the inhaler away from your face. Shake it well and release 2 puffs into the air. Now your PMDI is ready to use. Instructions to use your PMDI: sit or stand upright. Remove the mouthpiece cap and shake the inhaler well. Hold the inhaler upright with your thumb below the base of the mouthpiece and 1 or 2 fingers on top of the canister. Breathe out fully through your mouth. Place the mouthpiece in your mouth between your teeth and close your lips firmly around it. Do not bite it. Now, start breathing in slowly through your mouth. As you are breathing in, press down the canister to release 1 puff while continuing to breathe in slowly and deeply. Remove the inhaler from your mouth. Hold your breath for about 10 seconds or for as long as it's comfortable. And then breathe out normally. If another puff is required, wait for at least 1 minute and then repeat these steps again. After use, replace the mouthpiece cap firmly. Special instructions: after taking each dose, rinse your mouth with water and spit it out. In case of difficulty in using the inhaler correctly, you may use it along with the spacer. Clean the PMDI at least once a week. For more information, refer to the patient information leaflet provided with the PMDI pack. Do not tamper or change the number on the dose counter.
We will now show you how easy it is to measure your lung power, that is PEFR, peak expiratory flow rate, using this simple device called breathometer. This is a breathometer pack. It contains a breathometer and a patient information leaflet. You can always refer to the patient information leaflet to know about your breathometer in detail. This is a breathometer and this is the mouthpiece. Please attach mouthpiece to your breathometer in this manner. First of all, move the pointer along the slot towards the mouthpiece till it does not move any further. Hold the breathometer so that your fingers are away from the scale and slot. While holding the device, do not press hard with your fingers because this may damage the device and affect the reading. It is better to take your PEFR reading while standing up. Breathe in deeply. Then place the mouthpiece of the breathometer in your mouth between your teeth. Keep your lips closed firmly around the mouthpiece. Blow out just once, as hard and fast as you can, just like you blow out candles on your birthday cake, all at once. The number where the pointer stops is your first reading, that is PEFR, peak expiratory flow rate. Note it down. Repeat the above step twice so as to obtain 3 readings. The highest of the 3 readings is your PEFR reading, which indicates the power of your lung. Important instructions: do not cough or spit into the breathometer as it may affect the reading. Hence, it is recommended to take a new reading. Never drop the breathometer as it may affect the precision of the device. For more information, please refer to patient information leaflet provided with the breathometer pack. I'll now show you how easy it is to use this simple device called rotahaler. This is a rotahaler pack. It contains a rotahaler and a patient information leaflet. You should always refer to the patient information leaflet before using the rotahaler. The rotahaler consists of a mouthpiece, rotacap hole, fin, and a base. To use your rotahaler, hold the rotahaler vertically and position the two halves of the rotahaler such that the fin is not directly below the rotacap hole. Remove a rotacap from its bottle and insert it into the rotacap hole with its transparent end facing downwards. Press the rotacap firmly so that its top end is in level with the top of the rotacap hole. Hold the mouthpiece firmly with one hand and rotate the base. The fin separates the two halves of the rotacap as can be seen through the transparent rotahaler. The rotahaler is now ready for use. Sit or stand upright. Breathe out fully through your mouth. Place the mouthpiece of the rotahaler between your teeth and close your lips tightly around it. Tilt your head slightly backward. Breathe in through your mouth as rapidly and deeply as you can. When done correctly, you will hear the rotacap rattling inside the rotahaler. Remove the rotahaler from your mouth and hold your breath for about 10 seconds or for as long as you're comfortable, and then breathe out normally. If you find some powder still remaining in the rotahaler, again breathe out fully and breathe in rapidly and deeply through the mouthpiece of the rotahaler. Make sure that you inhale all the powder inside the rotahaler. If another dose is required, insert a new rotacap into the rotacap hole. This will push out the empty rotacap remaining in the rotacap hole, and then repeat the previously mentioned steps. After use, separate the two halves of the rotahaler and discard the empty rotacaps. Then rejoin the two halves of the rotahaler. Important instructions. Clean the rotahaler at least once a week. Separate the two halves of the rotahaler. Rinse the two halves in clean running water and then shake well to remove excess water and leave to air dry. Keep the rotahaler clean and dry at all times. Never use the rotahaler when it is wet. Keep the rotacap bottle tightly closed to avoid exposure to moisture. Remove a rotacap from its bottle and insert it into the rotahaler just prior to use. Make sure that your hands are completely dry. After taking each dose, rinse your mouth with water and spit it out. It is recommended to use a new rotahaler every 6 months. Do not push any cloth or instrument into the mouthpiece as this may damage the rotahaler. For more information, please refer to the patient information leaflet provided with the rotahaler bank. How easy it is to use this simple device called Zero-Stat VT Spacer with your inhaler. Zero-Stat VT Spacer helps you to take the medicine from the inhaler comfortably. It gives you more time to inhale and allows you to obtain full benefit of the medicine released from the inhaler. This is a Zero-Stat VT Spacer pack. It contains a Zero-Stat VT Spacer and a patient information leaflet. You should always refer to the patient information leaflet before using the Zero-Stat VT Spacer. The Zero-Stat VT Spacer consists of inhalation chamber, a lock, mouthpiece cap, and mouthpiece. We will now show you how to use your Zero-Stat VT Spacer. Assemble your Zero-Stat VT Spacer by firmly pushing the two halves of the spacer together and rotate. The Zero-Stat VT Spacer comes with two locks which ensure proper assembling of the two halves. Make sure that mouthpiece is closed with the cap. Remove the cap from the mouthpiece of the inhaler. Shake the inhaler well. Insert the inhaler firmly into the opposite end of the Zero-Stat VT Spacer Holding the inhaler, press down the canister to release a dose into the zero-stat VT spacer. Breathe out fully through mouth and immediately remove the mouthpiece cap from the zero-stat VT spacer and close your lips firmly around the mouthpiece to create a good seal. Do not bite it. Breathe in through your mouth slowly and deeply, thus inhaling the medicine through the spacer. Remove the zero-stat VT spacer from your mouth and hold your breath for about 10 seconds or as long as you're comfortable, and then breathe out normally. If another dose is required, wait for 1 minute and then repeat the previously mentioned steps. Shake the inhaler, insert and actuate. Breathe out fully. Breathe in through zero-stat VT spacer slowly and deeply and hold your breath for about 10 seconds or as long as you're comfortable, and then breathe out normally. Important instructions. Clean the zero-stat VT spacer at least once a week. Separate the two halves of the spacer. Rinse both the halves in clean water and then shake to remove excess water. Leave to air dry. Ensure that the zero-stat VT spacer is completely dry at all times. Do not clean with boiling or hot water, as this will damage your zero-stat VT spacer. After taking each dose, rinse your mouth with water and spit it out. It is recommended that zero-stat VT spacer should be replaced with a new one after 6 months of use. For more information, please refer to the patient information leaflet provided with the zero-stat VT spacer pack. We will now show you how easy it is to use this simple device called half-puff kit. This is a half-puff kit. It contains a baby mask, spacer, an instruction leaflet, and a storage case. You should always refer to the instruction leaflet before using the half-puff kit. To use your half-puff kit, remove the mouthpiece cap from the inhaler. Shake the inhaler well. Insert the inhaler into the half-puff kit like this. The half-puff kit is now ready to use. Holding the inhaler, press down the canister to release one dose into the half-puff kit. Without any delay, make the child sit or lie on your lap and hold the baby mask firmly over the mouth and nose of your child, keeping the half-puff kit and the inhaler upright. Ensure that the exhalation vent fits over the nose. Let the child breathe normally for 60 seconds and then remove the mask. If a second dose is required, wait for at least 1 minute. Remove the inhaler and repeat the previous steps. Shake the inhaler well. Insert the inhaler into the half-puff kit. Press down on the canister. Keeping the half-puff kit and inhaler upright, hold the baby mask firmly over the mouth and nose of your child, also ensuring that the exhalation vent fits over the nose. Let the child breathe normally for 60 seconds and then remove the mask. Remove the inhaler and replace the mouthpiece cap. Important instructions. Clean the half-puff kit at least once a week. Separate the two halves of the spacer by rotating and gently pulling them apart. Rinse both halves in clean running water. Shake out excess water and air dry. Ensure that the half-puff kit is completely dry at all times. Do not clean with boiling or hot water, as this will damage your half-puff kit. Do not dismantle the half-puff kit beyond what is recommended. Do not push any cleaning cloth or instrument in the area between the spacer and the mask, as this may cause damage. Always store the half-puff kit in the case provided. Replace the half-puff kit with a new one after 6 months of use. For more information, please refer to the instruction leaflet provided with the half-puff kit.
Hi, we will now show you how to use your nebulizer correctly. The nebulizer is a system that converts liquid medication into a mist which can be inhaled by the patient. The whole procedure will be explained in 5 sessions. Parts of the nebulizer: assembling the nebulizer, using the nebulizer, cleaning and maintenance of the nebulizer. Important instructions. Parts of the nebulizer. The nebulizer consists of a compressor and 2 separate kits, that is, adult kit and pediatric kit. The compressor consists of a filter, power switch, power cord, air outlet, air opening, and rubber pads. The adult kit contains an adult mask, mouthpiece, cap, baffle, medication chamber, and tubing. Before using the nebulizer, please read the user manual provided by the manufacturer. Now, we will show you how to assemble the nebulizer. Place the compressor on a sturdy surface so that the rubber pads are resting on it. Please do not place the compressor in this manner, that is, vertical position. And never keep the compressor on soft surfaces such as the patient's lap or a bed or a couch, as this may block the air openings. Plug the power cord into a power socket. Connect one end of the nebulizer tubing to the compressor air outlet. Open the cap of the medication chamber. Check if the baffle is in place. Remove the respule from the light protected pouch. Respule is a ready-to-use ampule containing the medication. Twist the respule to open it and squeeze the liquid medication into the medication chamber. Reattach the cap. The volume of the liquid should be between 2 to 5 ml. Attach the mouthpiece to the cap of the medication chamber in this manner. The mask is preferred over a mouthpiece when the patient is unconscious or cannot hold the mouthpiece comfortably. Connect the other end of the nebulizer tubing at the bottom of the medication chamber. Now, the nebulizer is ready for use. Using the nebulizer, hold the mouthpiece in your mouth in this manner. Switch on the power and the compressor. A fine mist of medication is released, which can be inhaled deeply and slowly through the mouth. Holding the breath after inhaling the medication allows for optimal absorption of the medication in the lungs. Exhale slowly. Continue nebulization for about 5 to 10 minutes till you hear a spluttering sound from the nebulizer system. Then switch off the compressor after a minute. Some amount of liquid medication will always remain in the medication chamber. Discard it. Turn the power switch off and unplug the power cord from the power socket. Cleaning and maintenance of the nebulizer. The nebulizer system should be cleaned after each use to prevent the possible risk of infection. Cleaning the compressor. Wipe the outside of the compressor with a clean cloth regularly to keep it dust-free. The filter should be changed when it discolors totally. Cleaning the nebulizer kit. For cleaning, remove the tubing. Detach the mouthpiece or mask from the cap of the medication chamber. Open the cap by turning it counterclockwise and remove the baffle. Wash all the items except the tubing in warm water or a mild detergent solution. Rinse with warm water to remove the detergent residue. Allow to air dry. Cleaning the tubing. Keep the outer surface of the tubing dust-free by wiping it regularly. If you notice some liquid droplets in the tubing, connect the tubing to the compressor outlet. Switch on the compressor and blow air through the tubing for a few seconds. Disinfecting the nebulizer kit. The nebulizer kit should be disinfected daily. In a clean container, soak all the accessories except the tubing for 30 minutes in a commercially available medical disinfectant or a mild detergent or vinegar solution. 1 part white vinegar and 3 parts warm water. With clean hands, remove the accessories and rinse with warm water. Then, air dry. Important instructions. Do not place the compressor in water or drop it into water or any other liquid. Do not reuse or wash the filter or substitute with any other material such as cotton in its place. It will result in compressor damage. Replace the accessories if any cracks appear. Ensure the volume in the chamber to be between 2 to 5 ml for proper nebulization. Always keep the respules in the light protected pouch provided by the manufacturer when not in use.
We will now show you how easy it is to use your nasal spray. Your nasal spray pack contains a nasal spray bottle and a patient information leaflet. You should always refer to the patient information leaflet before using your nasal spray. If you're using your nasal spray for the first time, or if the nasal spray bottle has not been used for more than a week, you need to test your nasal spray. To test your nasal spray, shake the nasal spray bottle and remove the protective dust cap. Hold the bottle as shown with your forefinger and middle finger on either side of the nozzle and your thumb under the bottle. Now press down for a few times until a fine mist comes out of the nozzle. Now the nasal spray is ready for use. First, blow your nose gently. Then shake the nasal spray bottle and remove the protective dust cap. Hold the bottle as shown. Close one of the nostrils using your finger and slightly tilt your head forward. Keep the bottle upright and carefully insert the tip of the nozzle in other nostril in this manner. And while breathing in, press down the bottle once to release a spray. Remove the bottle from nostril and breathe out through your mouth. If a second dose is recommended, repeat the previous steps. Shake the bottle gently, close one nostril, insert the nozzle, press while breathing in, breathe out through your mouth. Repeat the previous steps for the other nostril. Close one nostril, insert the nozzle, press while breathing in, breathe out through your mouth. If the second dose is recommended in the other nostril, repeat the previous steps. After using nasal spray, wipe the nozzle with a clean cloth or a tissue and replace the protective dust cap. Important instructions. Clean your nasal spray at least once a week. To clean your nasal spray, soak the nozzle and the dust cap in a bowl of warm water for a few minutes. Now, rinse both under clean running water and allow them to air dry. Never try to unblock the nozzle using a pin or any other sharp object. Do not allow any other person to use your nasal spray. For more information, please refer to the patient information leaflet provided with the nasal spray pack. How easy it is to use this simple device called Revolver. The existing Revolver is now improved. This is a new Revolver pack. It contains a Revolver, a carrying pouch and a patient information leaflet. You should always refer to the patient information leaflet before using the Revolver. To open the Revolver, hold it at its base and pull back the mouthpiece until both arrows meet. Take your rotacap out of the bottle, insert it into the rotacap chamber, keeping its transparent end facing downwards. Close the mouthpiece till you hear a click sound like this. You can sit or stand upright. Keep your head straight. Now, breathe out fully through your mouth. Hold the mouthpiece in between your teeth and close your lips tightly around it. Breathe in through your mouth as rapidly and deeply as you can. When done correctly, you will hear the rotacap vibrating inside the Revolver. Take the Revolver out of your mouth. Hold your breath for about 10 seconds or as long as you're comfortable and breathe out normally. If you find any powder still remaining in the rotacap chamber, again breathe out fully and inhale rapidly and deeply through the Revolver. Make sure that you inhale all the powder inside the rotacap chamber. After every use, open the mouthpiece till both arrows meet and discard the empty rotacap. Close the mouthpiece and keep the Revolver in the convenient carrying pouch provided. Important instructions. Clean the Revolver at least once a week to ensure smooth functioning. Rinse the mouthpiece and rotacap chamber under clean running water and allow it to air dry. It is recommended to use a new Revolver after every 6 months. For more information, please refer to patient information leaflet provided with the Revolver pack.
going to show you how to use SynchroBreathe, the new generation inhaler. If your doctor has prescribed you SynchroBreathe, you simply need to understand how to use it. And we will help you to do just that. All you have to remember is click, click, click. First, shake your SynchroBreathe, keeping the mouthpiece cover closed. Then open it by gently pulling the cover down. And there we have the first click. Exhale as much as you can before you put the SynchroBreathe in your mouth and start breathing slowly and deeply through the mouthpiece. You'll then hear the second click, indicating that the medicine is being released. But keep in mind to continue inhaling even after the second click. When you're done, remove the SynchroBreathe from your mouth. And hold your breath for 10 seconds or as long as comfortable, and then breathe out slowly through your nose. After that, close the mouthpiece cover, and that's the final third click. Always remember, after using the inhaler, rinse your mouth with water and make sure you don't swallow it. If you need another puff, follow the same click, click, click process. And that's how easy it is to use SynchroBreathe. All you have to remember is click, click, click. Click to open, click to inhale, click to close. Do consult your doctor on frequency and use. There are a lot of questions that come up when it comes to inhalers. Let me give you some information on the top 5 frequently asked questions on SynchroBreathe.
How do I know how many doses remain in my SynchroBreathe?
SynchroBreathe comes with an integrated dose counter, which moves at the interval of 20 puffs. When the last 40 puffs are remaining, the color of the dose counter ring changes from green to red, indicating that only few doses are remaining. And you need to arrange for a new device. When the dose counter displays 0, it's time to discard your SynchroBreathe. After 0, do not use the device since it does not contain the required amount of medicine.
Why is there a notch at the back of my SynchroBreathe?
The notch is a dose release button at the back of a SynchroBreathe, right below the dose counter. The button helps in test firing the device. The test firing of SynchroBreathe should be done on 2 occasions. First, when you're using the device for the first time, and second, if you haven't used it for a week or more. In order to test fire SynchroBreathe, you need to release 2 puffs into the air. First, shake the inhaler and open the mouthpiece cover. Then fire the test dose to release the first puff into the air by pushing down the notch. Close the mouthpiece cover. Repeat these steps to release the second puff. And remember, to not use the dose release button for inhaling the medicine.
I get a medicinal taste in my mouth after using SynchroBreathe. Is there a reason for concern?
Yeah, sometimes you get a bitter taste after use of SynchroBreathe, which is absolutely normal. Some amount of medicine may remain at the back of the throat. You can just rinse your mouth and gargle. And remember, do not swallow.
What if I accidentally open the mouthpiece cover and do not take inhaler? Will there be any medicine loss?
Don't worry. If you accidentally open the inhaler, there will be no medicine loss. Just close the mouthpiece cover immediately. The SynchroBreathe only releases a dose of medicine when you place the mouthpiece in your mouth and inhale through it. However, it is important to open the mouthpiece cover gently to avoid accidental release of a dose.
How do I appropriately clean and store my SynchroBreathe?
Clean your SynchroBreathe once a week by opening the mouthpiece and wiping with a dry cloth or tissue. You should not wash your SynchroBreathe with water. Always keep it dry. There it is. For more information, consult your doctor. And when it comes to using the SynchroBreathe inhaler, just remember, click, click, click. Click to open. Click to inhale. Click to close.